Today I'm going to be discussing the molecular mechanisms of beta blockers. But first, we need to review how action potentials are generated and regulated. Action potentials are generated in the sinoatrial node. This is from the combination of channels opening at specific voltages and is known as the pacemaker due to downstream influence of action potentials. But how does this happen? Under normal conditions, there's a stable amount of potassium in the cytoplasm, which maintains concentration. Next, HCN channels open at negative 60 millivolts to allow for sodium uptake. At negative 50 millivolts, T-type calcium channels open, further increasing the charge. At negative 40 millivolts, depolarization occurs, where even more calcium is taken up from L-type calcium channels. Finally, potassium channels open, resulting in repolarization. We now know how the SA node generates action potentials, but how does a change of pace happen? The SA node can increase or decrease heart rate. Through activation of beta-adrenergic receptors by norepinephrine or epinephrine, we can increase the heart rate. By activating cholinergic receptors by acetylcholine, we can decrease our heart rate. For understanding beta blockers, we are concerned about increased heart rate. Increased heart rate starts with epinephrine or norepinephrine binding to beta receptors. This binding causes a change in shape, releasing the alpha S subunit to activate adenylyl cyclase. Activation of adenylyl cyclase produces CAMP and pKa. These molecules can then activate HCN and L-type calcium channels, resulting in faster pacemaker and depolarization. So now we know how heart rate can be increased. But why would we want to block beta receptors? In heart failure, beta drive is constantly activated, and this chronic stress results in jerk-2 binding, switching alpha S to alpha inhibitory and tagging beta receptors for removal, meaning decreased heart rate. Beta blockers can stop this stimulation and jerk-2 binding, which preserves some beta receptors, decreases, and prolongs heart failure. In the end, 30 million Americans use beta blockers. This allows us to enjoy more time with our loved ones. Thank you.